Welcome to Lecture 2 of 2 of Week 3. Our remaining topics for discussion are the ethics of quality and patient issues and ethics. Quality in healthcare ranks among the leading concerns for patients, administrators, providers, and other health professionals. In this chapter, our focus is on the ethics of quality. The agenda of topics for Chapter 11 provides a brief introduction and definitions concerning the topic of quality, followed by a historical view of quality, the organizational response to quality, a look beyond compliance, and a review of the ethics of quality. Let's begin with the introduction and a few definitions. Quality is essential in the delivery of healthcare. Effective healthcare is viewed when there remains a balance amongst cost, access, and quality. All three interrelate and have a significant impact on outcomes. The term quality may be defined from numerous perspectives. However, I always have said that quality in healthcare varies contingent upon who you've talked to. We all view quality from different perspectives. What one may view as quality, another may not, and vice versa. A common tool to measure quality in healthcare is the Donabadian model, which focuses on structure, processes, and outcomes. From a historical perspective, Morrison denoted that there was no regulation in healthcare. Thus, healthcare professionals were the primary source that monitored how healthcare services were delivered. A shift within the culture yields the need for accountability. Consequently, the Joint Commission was among the first organizations that produced regulations for healthcare. Using various quality initiatives, the Joint Commission produced programs related to quality assurance and patient safety. Its quality check programs provide health consumers with important information in regards to obtaining various services from health providers, entities, etc. Furthermore, the Joint Commission offers special initiatives to assure quality in healthcare organizations. The Affordable Care Act addresses the issue of quality. Quality also plays an intricate role in physician-hospital reimbursements. Looking through the eyes of the organization at large, having a reputation of producing quality work, having competent and high-skilled and high-qualified personnel on your staff, all are great assets for your business and can definitely give you a competitive edge within the market. To assist healthcare organizations attain and maintain a level of quality, there are numerous government agencies available, such as the Centers for Medicare and Medicaid Services. CMS has become a major player in quality assurance in healthcare. The Center for Clinical Standards and Quality is another agency that's active in the development of assessments to measure patient quality. Other agencies may include, but not limited to, the Agency for Healthcare Research and Quality, the Institute for Healthcare Improvement, and the National Committee for Quality Assurance. A few common tools and methods utilized to assess quality in healthcare organizations are the Shewhart cycle, Lean Six Sigma, root cause analysis, and the Baldrige criteria. Looking through an ethics lens, Kant, Buber, and Frankel view quality as a duty for healthcare organizations. Emphasis is on providing the greatest good to and for the patient while eliminating harm and pain. Rawls believed that all are entitled to quality via the social justice principle. The principles of autonomy, beneficence, and non-malfeasance and justice also apply to quality. Let's now direct our attention to Chapter 12, which is entitled Patient Issues and Ethics. Chapter 12 addresses patient cultural evolution, measuring the patient experience, the ethics of measurement, patient-centered care, and the administrator's role. To begin, let's review a few facts. Historically, the healthcare system was dominated by physicians. The medical profession controlled the supply and demand for medical services. Paternalism was part of a medical model, meaning that patients would receive health care based on their needs as deemed appropriate by medical professionals, thus restricting the patient's freedom of choice. Patients in general believe that the doctor always knew best, therefore they automatically had that trust and always believed that he or she would practice benevolence in regards to always having their best interests at heart, and that the provider had a moral obligation to reducing pain and suffering and making them feel better. As time progressed and disruptive technology became in more demand, the medical model shifted from paternalism. In addition, health insurance, integrative medicine, and health reform also played and continues to play a role in healthcare delivery models. There are numerous factors that influence patient culture. One in particular is health literacy. More and more patients play an active role in their treatments. They are informed and conduct research regarding various options of treatment and payer sources. Some patients are better in controlling their healthcare expenditures. Another influential factor is the types of patient culture that you as a healthcare administrator are working with. You have three primary groups that were discussed in your textbook. One, the patient partner culture. In this culture, the patient possess certain expectations of the providers and the systems. For example, the patients would expect that the provider will make them well. As far as the system at large, is that it would be equipped with the latest technology, hire the competent providers, and have all other resources that is needed to provide and yield quality, effective healthcare services to them either during their stay or visit at the medical facility. Another type of culture is the compliant patients. These patients do as they're told. They really don't ask many questions. They don't question the rationale or treatment plan as described by the provider. They pretty much just trust what they say and keep it moving, if you will. And then we have those that are non-compliants, who it does not matter what the doctors say, they're just going to do what they want to do. These are the ones who lead AMA in hospitals against medical advice. In healthcare, the patient experience is critical. There are numerous tools healthcare organizations utilize to measure patient satisfaction. For example, the HCAHPS, the PSQ by the RAND Group, and the Press-Ganey survey of patient satisfaction. This is just a few. When measuring patient experiences, administrators should practice veracity, thus ensuring accuracy of data collection and results. From an ethical standpoint, Kant would view measurement of patient satisfaction, etc., that there is a moral duty to treat patients with the utmost respect. It is imperative that administrators, providers, etc., realize that patients are human beings. They're not numbers. According to Mill's philosophy, he always would want us to focus and think about the greatest good for the greatest number through knowing the consequences of our actions. Therefore, always choose to do good, which will increase the likelihood of yielding greater and more positive results. However, the results are based on your behavior and your actions. Rawls' philosophy lies under creating the ideal of protecting the least well-off, yet still treating them with dignity. Social justice means paying attention to the patient, listening to what he or she has to say. And of course, the remaining principles of autonomy, non-malfeasance, and beneficence also applies in regards to the ethics of measurement. More and more healthcare organizations utilize the patient-centered care approach as an effective model to increase quality and ensure a positive patient experience. One model discussed in your textbook is the plan tree model. This model is a holistic approach to treat all aspects of the human body, meaning the physical, mental, emotional, social, etc. The next few slides provides additional information and highlight key points regarding this model and how this model originated. Please review. In conclusion, do you believe it is necessary to support and have patient-centered care as a model for a successful practice of healthcare deliverables? As a healthcare administrator, you must keep abreast of the best approaches and strategies, then customize them to fit your healthcare organization. Remember, submit all questions to your professor via email. And congratulations, this concludes the lecture for week 3. Don't forget to complete your self-assessments. It's been a pleasure.